In. Um, well, welcome to Thursday of Affordable Housing Week. Um, this panel is co-hosted by PDA and DSC, two providers of um, homeless care services and housing. Um, and my name is Kyler. I'm with HDC, the Housing Development Consortium. One of my favorite things about us getting to help coordinate Affordable Housing Week is things like this, where we get to highlight different parts of the affordable housing broader sector and community. This morning, I got to hear about preserving affordable housing with Seed down in Columbia City. I think the remaining events after this are going to be. I'll put the link here to the rest of Affordable Housing Week stuff, but I think it's just there's a happy hour closing reception thing at Stoop Brewing in Capitol Hill this afternoon, and then an event for the Black Home Initiative Policy Network happy hour in Soto tomorrow evening. So if you're interested about just want to connect with people or interested in what BHI is up to, those are a couple more great events. But yeah, we're kind of at the tail end here of 20 plus events. And really excited about highlighting some of the work that's being done on the ground, particularly in the city of Seattle, to expand shelter options. And we're going to be talking about what that looks like, and what some of our providers are up to, what wraparound supportive shelter options can look like, and how those can interact with our affordable housing systems. So without further ado, I'm going to hand it off to our panelists, who each will do about half-hour presentations and half-hour questions. So feel free to pop questions into the chat. And yeah, I'm going to kick it off to Crystal. Can you introduce yourself?
Hi, good afternoon, everyone. My name is Crystal Erickson. I am with PDA. I've been with PDA since 2021. I have been with our aftercare program since it began in 2023 and helped co-develop the aftercare service model and team of housing specialists. And I'll pass it to Lindsay.
Hi, everyone. Thank you for joining us. My name is Lindsay. I am currently a participant support specialist at our new lodging, County House Village in Lake City, for co-lead. I started my career with Lehigh in permanent supportive housing and dabbled in property management for a little while. With that, I'll hand it to Noah.
Thanks, Lindsay. Hi, everybody. My name is Noah Fay. I'm the Senior Director of Housing Programs with DESC. It's an honor to be here with you at Affordable Housing Week. I'm excited to talk about some of the creative work that's been happening in the shelter space. And let me hand back to Crystal to take it from there.
Thank you so much, Noah. Okay, so I'm going to go ahead and introduce PDA. PDA was formed in 1986 as a Defender Association, and provided high-quality legal defense and civil rights for civil rights activists in Seattle. In 2013, we began concentrating on alternative public safety models when King County created an in-house public defense program. That's okay. Thank you. In 2021, we adopted a co-director structure, recognizing the value of power sharing. We have a multicultural team of lawyers, organizers, project managers, social workers, and direct service providers. We have our LEAD program that is part of PDA. LEAD stands for Law Enforcement Assisted Diversion, or now more currently, Let Everyone Lead, Let Everyone Advance with Dignity.
Smith, SMITHMENTZ.
in our program with Purpose Dignity Action. It was established in 2021 in response to the impacts of war on drugs, mass incarceration, and chronic homelessness in the city of Seattle. It was created to divert individuals engaged in low offenses away from the criminal legal system to help support them. Instead of punitive actions like going to jail, we wanted to connect people with social services instead. Our lead framework emphasizes harm reduction, relationship-based engagement, and community-centered care over punishment and incarceration. In 2020, our co-lead program was developed through the LEAD model. Co-lead is a service provider to LEAD. We were developed through the pandemic, the COVID-19 pandemic. We had several individuals being released from jails in masses due to COVID-19, and our response to that was to help folks through the LEAD model go from being released from jail into hotels like enhanced shelter hotels, and then provide case management services to those folks so they didn't return back to the streets or into incarceration. Next slide, thanks. Those we serve are those who are impacted by the criminal justice system, who have legal involvement, folks that are unsheltered and unhoused. Most of our folks that we serve do have some challenges with mental health and unaddressed substance use disorder. Our approach to this work is through having case managers on site, using clinical skills such as harm reduction, housing first approach, trauma-informed care, and field-based engagement. We have a 24-hour enhanced shelter site within co-lead, and we provide lodging there. It's open 24 hours. For single adults, we focus on their basic needs, healthcare, behavioral health, accessing medications, and resource connections. Services emphasize stability from from our shelter site into housing. And I'm going to pass it to Lindsay to just give a quick overview of our 3 phases in co-lead, because we do have 3 phases.
Yeah, so we have outreach. Our outreach team engages with them directly from their sites, their, where they're, sidewalks and tents, and outreach develops relationships, which is vital. They earn trust, and then through certain funding, they place them into lodging. Lodging is sort of where I am right now, where we provide wraparound care. So we have the legal process that we help them with. We help them get their documents. We try to get them stabilized as much as we can before we move them into housing. And our aftercare is vital, because aftercare will actually come to lodging and get to know the folks before they move to their permanent supportive buildings. Sorry. And so when you're moving from place to place, pretty rapidly within probably about 6 months, it can be very overwhelming. When they move into permanent supportive housing, it can look very different, but usually they're on a 1-year lease, which can be very overwhelming. And so aftercare kind of goes with the client to support them on their journey for approximately 1 year, sometimes a little bit longer, while they're in supportive housing.
Thank you, Lindsay. So aftercare, as Lindsay mentioned, is our ongoing support from our temporary lodging site, which is just essentially enhanced shelter. And aftercare services are through a housing specialist and provides supplement on-site housing case management support and a little bit more intensive case management in some cases. It helps reduce supportive housing churn and sets people up for success on day one of housing. And it helps establish tenant independence and for the goal of improving long-term success and retention for the participant. Matching support services to participant needs. How we do this in aftercare is through a participant-led housing stability plan that focuses on their goals, their strengths, and areas of support to promote long-term housing retention. The services are tailored to the participant. Each participant is different. Sorry, I have background noise because we're downtown. And sorry. Okay, it's passed. The areas of concentration that we focus on to promote housing stability are engagement with the housing specialist, connection to healthcare, behavioral health, recovery support services, helping the participant understand their lease expectations, their tenant rights, and their housing responsibilities, building partnership with their housing case manager on site. So that when we are no longer in the picture, they can continue to be supported, know who's going to support them. We also help address legal concerns to help reduce the barriers that may impact their housing stability and other areas such as improving quality of life, like connection to community, meaning getting them connected with meaningful activities that they enjoy, and social support networks. We really try to identify the early warning signs of housing instability and create proactive support plans with them. This slide shows a snapshot of our model of care. We have a very well-developed, written out model of care. This goes through the progression of the time in the first 12 months that somebody is housed. We support folks in their housing for up to 12 months, sometimes longer, just kind of depending on the needs and their needs and services we can provide. This aftercare progression, oh, sorry, go back one more. This aftercare progression, it does have a milestone outcomes attached to it. And so we try to make sure that we're assessing along the way that folks are going through these phases in our program. And so one way that's really important that we do this is through our partnership with the housing provider staff in coordinating transition into housing. So they are when they're connected with their housing provider, they have clear expectations and understand the areas that could possibly impact their housing over time. That's it. Yeah. Thank you. And then I will pass it to Lindsay to go over Jean Darcy.
Yeah, so Jean Darcy is an example of a permanent supportive model. It was essentially a pilot program. The KCRHA funded these folks rent for 1 year. Approximately 1 year. And then we provided full-time case management and we brought resources to them. And so we really used the co-lead model. Outreach was extra supportive. Outreach actually assisted with funding a D1 transportation van I might jump around a little bit, so bear with me. When they are dealing with, serious substance abuse issues, it's really difficult for them to gain full-time stability. Things like time management, making sure appointments, um, etc. And so, coming from actually the participants, they wanted to be able to have stability. And with that, some of it looks different for everybody, but we started transportation to the methadone program. And so we implemented a routine where they went and knocked on doors, and we got them up same time every day. The van took them back and forth. And where are we at here? The community room. So that's just one way that outreach was a huge part of Gene Darcy. Aftercare was vital because aftercare, the residents were familiar with aftercare staff. So when we were sitting down doing the lease signing, that can be very overwhelming. It's a lot of information, a lot of big words they don't understand. It can be very scary. I mean, a lot of them haven't even been indoors for a long period of time. And so we all sat down together, the property manager, me being the case manager, we had the aftercare case managers, and then the residents to make sure that they really understood their lease. This is an example of our community building. So Jane Darcy was built essentially just to be a regular building. It wasn't made actually to be a supportive housing building. And so we had to think outside the box to have a room for them to meet privately, maybe with mental health counselors, or like as you see, we had a lot of community. We did arts and crafts. We held MOUD classes, recovery classes. We did holiday things in there, but it started out as a storage closet, and we converted it into a community room. So that was pretty amazing. I would say that the community room was built with everybody. So, aftercare supported, the outreach team supported, Lehigh supported. It was really, a community-based project that built community for the residents. And so, when they're coming in from outside, their community is outside. They don't necessarily have a healthy place to create new relationships. And so this provided that.
Thanks, Lindsay. Oh,
Yeah.
I just wanted to jump in. So there were also some ways that Aftercare and Gene Darcy collaborated together with supporting the participants that moved into this new building. Lindsay was part of one of the first staff when this building opened, and there were challenges coming up with between the housing provider and the participants, some things related to their behavioral health and some compliances with the lease. One example that we had was a individual had collected a lot of items in their unit, and it was getting to the point of being out of compliance with their lease, and Aftercare came in to help mitigate and support those challenges with the participant, and support the housing provider, and just act as a bridge. I don't know, Lindsay, did you have anything you wanted to add about that?
Yeah, when they're protected under tenant landlord law. So for example, it can be construed as harassment. Like if I'm going and knocking on their door, it's not a compliance-based program. So they have a choice. They don't have to work with case management, even if things like this arise with lease compliance. And so Aftercare actually had an advantage. They came every day to support her. And They supported with, a mobility transfer, just different kinds of things to help support her that we couldn't always provide as the housing case manager.
Okay. Lindsay, did you want to talk about the pets at Jean Darcy?
Yeah, so this is Haro, Country, and Marlowe. A lot of our folks came in with pets. As you can see, we even had snapping turtles. I just wanted to share that, they can be really important companions for them. Again, like with lease compliance, we had to make sure that they had their vaccines, that they had emergency contacts in case anything happened. And aftercare and co-lead assisted a lot with that as well, just to get them ready to be able to even have them with them during move-in. Crystal, do you want to
Yeah,
start
sure.
us off?
We went through everything really quickly, and hopefully that leaves a lot of room for questions that we can answer. But we did want to share with you during around April, spring 2024 to July 2024, we moved folks from our co-lead lodging, which is our like an enhanced shelter, into Jean Darcy. And then we've worked with them in aftercare. Our housing specialist supported them throughout the year. And by early summer of the next year in 2025, we assessed that 99% of the folks that had moved into Jean Darcy were still maintaining their housing there. And so we wanted to share that information with you. And then Lindsay, do you want to talk about the other
Yeah,
engagement?
so approximately 8 months, a year in, we also started collecting data. So the 87% engagement across the board, how we determined that was anyone that engaged in any of the program services. So a lot of times it was collectively more than one, but did they get support with their MOUD? Did they want to work on their legal stuff? Were they in mental health counseling, primary care? And we had a whopping 87% engagement, which made them very successful and a lot more stable than when they came in.
And once folks are done and have completed the 12 months in our aftercare program, pending they don't have any more needs or we need to jump back in for anything, our folks go through graduation. Graduation looks like taking all the goals that the participant has worked on and writing out their accomplishments and any ongoing steps they need to, or they have identified that they need to do to continue maintaining housing. And we give that to them. And we follow up in 3 months to just check in, see how they're doing. Did they need any other services? Are things still going well? If things aren't, we can provide resources or maybe bring them back in to aftercare. That's happened pretty rare to bring them back in. We have provided some supports or connections to other care providers. But overall, folks that graduate are usually maintaining their housing.
Awesome. I'm sorry to jump in here. I'm Ashley. I forgot to introduce myself at the start, but I'm the Advocacy and Development Officer for Purpose Dignity Action, and I'm going to be transitioning us to DESC. But the main takeaway here is that we really saw a lot of success in what we did at Jean Darcy in creating supplemental support to a supportive housing program that Lehigh was running. And it was something that hasn't been historically. There are some supportive housing programs that just like haven't historically been able to address all the needs of some of our participants with really complex needs. And we know that's not for all supportive housing providers require that kind of added support, and that many are trying to level up their on-site supports. And but we know that a lot have welcomed this added resources to offer those additional programming and intensive case management. And we imagine that over time, as supportive housing models continue to evolve, the supplementary support might be less critical. But the relationship continuity that we saw between people who came from co-lead, moved into supportive housing, and still had that aftercare, we see it as always being really, really valuable, because we just know that a ton of caseworkers carry this kind of shadow caseload, that they're still connecting with people. So that was what our idea was with aftercare, was just kind of keeping that familiar, warm handoff and really leaning into this idea of continuity care from outreach to shelter all the way into supportive housing. And then, like Crystal said, sometimes a little bit beyond that. So from there, I would love to throw it to DESC, who is doing a ton of this work as well. And Noah, I will be controlling your slides.
Thanks, Ashley. Yeah, hey everybody, my name is Noah Fay. Again, we met 30 minutes ago. I'm going to talk about one element of DSC's programming, but the reason why I picked it, I think it's a good example of how we've tried to morph and adjust our thinking about how shelter can be best delivered in our community, how it can best be designed, and how it can best be situated so that we maximize the great work that our street outreach, mobile crisis, other teams are doing in the community, and ideally also serve to align where high needs shelter is operating, where we're working with really high needs people. How can we design those programs in such a way that those folks get their needs met, but then also align to housing resources in our community? So I think it's really critical here. It's not so much that shelter serves as a necessary step to housing. If we had enough housing, we could be moving people directly off the streets into permanent supportive housing and the programming that Ashley and Lindsay and Crystal talked about with that kind of wraparound care. But as a community, we all know full well we don't have nearly enough of that. So shelter plays a critical survival resource. And I think if we jump to the next slide, we've learned a lot about how we have designed that over the years. And so that's a bit of why I want to pick the Star Center. DSC does a lot of shelter work, a lot of outpatient behavioral health care work, a lot of street outreach work, MOUD work for people dealing with opiate use disorder, a ton of crisis response work. But the biggest bucket of our work is our site-based permanent supportive housing program. And all those things kind of come together. But we grew out of emergency shelter response that looked, as you see here, as a really, really crowded environment where the design of the program was always to prioritize getting as many people in off the streets as we could at any given time. Our focus was always to try to be as accessible and as low barrier as possible, meaning we'd work with people with really profound, challenging behaviors. That was the design. That's who we wanted to serve. That's who we wanted to get off the streets. But the way we did that was to bring people into really crowded spaces like you see here. Lessons learned during the pandemic, we weren't alone in all of this. If we jump to the next slide now, is that because there were a lot of quick orders that came down that we needed to send everybody home and have everybody socially distanced, we were running programs where that was just impossible because of the type of programming that we offer, the way it was designed. So we quickly up and moved our programs to hotels. A number of programs did similar things during this time. And unsurprisingly, things that we learned during that model, during that era of COVID, informed us that we can't ever go back to that old congregate, really crowded model of getting as many people in off the streets as we can. Because, as you see here on the screen, the University of Washington studied our program and several others that were run by other providers during peak pandemic era, that we just saw enormous benefits for people, which is totally unsurprising. Given our endorsement of the Housing First model and what we know, the platform of a safe, stable place, what that can mean for people. I think I was involved in this program at the time, and I will say, even as a tried and true Housing First believer, I was surprised by the overnight shift for people that we had known who often had been in our shelter programming or other shelter programming for years, almost became unrecognizable overnight. And so the need to permanently convert the shelter model, both at DSC and largely the community, away from congregate spaces to something that resembles more like a safe, stable platform that home provides for people is the necessary next step. That was fantastic, but go to the next slide. There were some trade-offs with that approach. So what we saw for the people who accessed the program is we saw major improvements qualitatively and quantitatively at a population level. Qualitatively, people described a sense of stability, a sense of ability to plan for the future that the old crowded model just didn't provide. But the trade-off was they were full every single night. Now, the old shelters were full all the time too, but that was a bit of a mirage in that people would come and go out of those shelters all the time, in no small part because they were just really difficult places to be. They weren't leaving the shelters more often than not to a permanent destination out of homelessness. They were just leaving the shelter because it was just hard to spend consecutive nights in such a crowded, stressful environment. So this new model was fantastic. It just limited the number of different unique people we were able to see. So the conscious decision here to prioritize the quality of the space over the quantity of people served had real tangible impacts on any given year. In that old model where you saw those bunk beds, we would see 3,500, 4,000 unique individuals come through that shelter program over the course of a year. The switch to these non-congregate hotel-based or other less congregate models, we saw it's a tenfold decrease, roughly 350 to 400 discrete people over the course of a year, which means it's great for those folks, but that means there were a whole bunch of people, if we go to the next slide, who we were no longer able to serve. And shelter plays a critical component in our larger system. The obvious one that everyone would point to is people need a place to be. They need shelter. It's the foundational piece of Maslow's hierarchy of needs is shelter, safe shelter. So to state the obvious, people need a place to go. But what often is hidden in all of that is shelter is also a key component of making all the great work we're doing out on the streets and engaging people where they are more effective. So earlier in my career, I had the privilege of being a street outreach worker. And one of the most effective things I was able to do was offer somebody a place to go. If I was able to build relationship and build trust and then be able to offer somebody a real meaningful resource like a shelter bed, invariably that was one of the most attractive things I was able to offer. That largely went away as the programs that we had designed were working really, really well. They just didn't have capacity to take new people. Same thing as our community invested in a whole bunch of crisis work in our community. DSC runs a large number of mobile crisis teams. Since then, we've stood up some more crisis resource. Often what we see is people in crisis. We're doing a lot in our community to go to folks experiencing crisis, but we don't have a whole lot in the way of places to send people. We've done more on that as a community since we started talking about all of this. But nonetheless, there's not a lot of that. Same with first responders, same with behavioral health care work. People are trying to do their best to deliver behavioral health care to folks experiencing homelessness, living unsheltered. And it's just, frankly, not as sticky, for lack of a better word, when someone doesn't have a place to go. It's harder to connect with people. It's harder to follow up with people. All stuff that I think we take a step back and think about is pretty obvious. But when we lost that really accessible, yet maybe less desirable in terms of its actual qualitative features, we had less of that in our community, making some of this outreach and crisis work less effective. So what we've decided to do is try to create a shelter program that aligns those things. So that's the Star Center. The Star Center, won't get into the development, all of that, although I bet there are many folks on the call who do housing development work. It's some interesting stuff there as we turned a former low-income housing tax credit property with some loans still on it into a shelter program. That's a whole nother story for folks who are really interested in that stuff. That's still a pretty interesting dynamic, but we converted that into a shelter program that was designed to specifically absorb people coming from referral only from outreach providers or behavioral healthcare providers, not a place-based response. So not because of where people were sleeping outside, but rather what kind of needs folks had, and give them a dedicated pathway into one specific shelter that while people are in that shelter, they are able to be wrapped in really pretty involved behavioral healthcare supports, which is really amazing because these are behavioral healthcare supports that are not funded by the behavioral healthcare system. They're funded by the homeless service system because our funders, in their genuine infinite wisdom, saw the value in some of that investment, making all of that other investment into street outreach and mobile crisis and great first responder work and mobile MOUD work that happens in our community more effective by making the place people go be a dedicated space for those folks. But then while they're there, wrap them in more involved behavioral health care, meaning the time someone's in the shelter is not just a reprieve from being outside, but it's a place and a time for people's behavioral health care to improve. That's something we saw with the physical designs changes we made, moving away from congregate to non-congregate. But the Star Center has programming. For instance, we have the ability to formally intake people into outpatient behavioral health care out of the shelter program, which is unheard of. You can come to a shelter, work with an intake provider, get a behavioral health benefit because you're in a specific shelter, as opposed to having to navigate the very, very busy, somewhat hard to access community mental health system of which we are a provider. So acknowledging just how difficult that historically has been, even when they're physically co-located or next door to each other. The fact that the shelter was designed to enroll people into behavioral health care, we're seeing people to the tune of around 95% of everyone who comes to the Star Center leaves with a behavioral health care enrollment that they likely would not have had otherwise. While there, we have occupational therapy. We have embedded recreation specialists run groups to make it a recovery-based environment in addition to just being a shelter. So it's a remarkably behavioral health rich environment, with the design being how can a shelter maximize the effectiveness of behavioral health care and vice versa, which is really amazing. The piece on the back end that we're working on, that we're still some improvements of, how do we align all of those things? So we've definitely aligned the street outreach with the shelter. How do we align shelters like co-lead, like the shelters that DSC runs, where we've got a lot of high needs people? How do we align that with a permanent supportive housing in our community that's also designed to meet their needs? Coordinated entry sits right in the middle of that slide between shelter and housing. And so that is a system we're still trying to work on to improve that we are aligning those resources better in our community. Because, and we'll flip to my last slide here before we get to questions, that the supports in high needs permanent supportive housing, the kind of permanent supportive housing that Ashley was referencing and the kind that DSC runs is really expensive. And I own that because the alternative is far more expensive and the outcomes are far worse for people if we don't invest in really heavy dedicated supports. So there's a lot of chatter in the community right now about insufficient supports in Housing First, or Housing First being housing only. And I think there are certain examples of where we've fallen down as a larger system on ensuring that's the case. Housing First done well in PSH is not that at all. It is a enormously service-rich environment that is highly interventionist. It's just not coercive. That is a key distinction that gets lost in this debate. And if we can align high needs people with these types of programs, they get access to the type of supports you see on the screen. So things like 24/7 staffing, kind of bare minimum stuff, everybody getting embedded housing case management, on-site housing case management, who do whatever it takes to help people stay housed. But then even more heavily involved stuff that really leans into the behavioral health care system, like embedding formal behavioral health care into the staffing model of the program itself, so people have access to outpatient behavioral health care resources in the program. How do we design and can we deploy more? We do this, but we'd like to do more. Mobile crisis and mobile MOUD work. So for people in behavioral health care crisis, how do we deploy a resource that isn't the police, or we don't lean on the ITA system? How do we deliver highly effective, we know highly effective MOUD services to people where they live? We've made that far more accessible in our community, but how do we make it so people don't have to seek that out? We bring it to them. That's work we're doing in PSH. And then how do we help people live in healthy conditions? We know a lot of folks in permanent supportive housing struggle maintaining their apartments and their units, and how do we bring supports to ensure people stay housed while still maintaining their overall living conditions? Those are the kind of supports that are baked into these programs, but what can we do as a community to align the people who need that with the resources that are out there? I think that is what the work our community is doing around shelter expansion is aimed towards, which is really exciting. It's not how we've thought about shelter before, and there's some good momentum surrounding all that.
Awesome. Great. Thank you all panelists, and thank you for all of that information. It's been really fun learning about more about DESC and our own programs. I'll hop into the chat for questions, and folks, if you have anything or want to add anything, but the first one that I see is this question of how is KCRHA still funding Gene Darcy residents, or how is it currently funded? Was the building purchased or master leased? Lindsay, do you want to talk a little bit about that?
Yeah, so the the Washington Commerce is funding Jane Darcy. So I'm not going to speak a lot on the way that whole thing works, but the idea of Jane Darcy was, if we can provide stable housing, if we can bring resources on site, kind of like what Noah was talking about, can we stabilize them enough to start paying their own rent? And so now, present day, they are slowly implementing, now you guys are going to start paying 10%, you're going to start paying 30% of your rent. So that's kind of the idea. But right now, as far as we know, it's still Washington Commerce and KCRHA funding Jane Darcy. Also, the lease, I don't know for sure, but I'm pretty sure they had bought the building, which is why it didn't come with it was halfway developed already as just a regular apartment building. That's why it didn't come with a community room. Yeah, I believe that Lehigh owns the building. You can correct me if I'm wrong, though.
Fantastic. And then the other question is, I often hear people say that increased shelter options should be tied to an increase in I hate this word, you guys. I know it's such an important word in this world and I can never say it. Coercive. Can you do it, Tyler?
Coercive.
Coercion. Yeah.
Everybody want to say it? Coercion into housing and services. Noah and others, why is it important for you that PSH is non-forced?
Yeah, that's a great question, Kyler. It's very relevant to the debate. Well, I mean, I could go in 1,000 directions on that. I mean, I think there's the practical and then there's the philosophical. I mean, practically, we're trying to end homelessness, and so requiring treatment provision and as a access to housing creates a barrier to ending homelessness if the goal is to do that first and foremost. But then more importantly, if the goal, and this is where I think well-meaning people want to see people get better and think if we therefore aren't coercing people, people won't take us up on treatment options that are available. And that's just actually not how that works. There are plenty of people out there for whom they've gone through a more coercive program. I mean, I'm thinking of like a diversion core program, and those things are perfectly fantastic for the folks they work for. The reality of the ground, there's tons of people for whom that has not worked. For invariably, most people that we serve at DSC have gone through court-ordered or mandated programming many different times. We have one highly well-known program that created a lot of controversy and developed a lot of commensurate research, which is great, that all 75 tenants combined on average had been to inpatient treatment 16 times. Often that was court ordered through different diversion programs, and they ended up back on the street struggling with the same stuff. So what we need to do is, if we actually want to help see people get better, we need to find ways to design services that speak to what people need and when they need them. So I think what comes from it is that there's a confusion that by us saying services aren't required, that means we don't want people to get better. It's not that at all. It's that we know what it takes for people to get better, and we have to design things people want. And mandated services don't work for a large number of people. The data bears that out. What gets lost, though, is somehow I think people confuse that as us somehow being passive. That we're just hoping and waiting and, all right, well, let's just house some folks and see if people get better. And that is the furthest thing from the truth. And I think us doing this work, we should always be looking in the mirror, making sure that we are always being super assertive, super interventionist with folks. What we're not doing is we're saying, if you don't take me up on the service option, we're kicking you back out, because that doesn't help anybody. Obviously, it contributes to people returning to homelessness, but it also doesn't increase the likelihood that people participate in services. What does is us designing things that actually speak to people's needs. So it's on us to figure that out. And we're quite successful at doing that. It just is a little bit more complicated than what I think your average person would like to see. And unfortunately, complex problems require complex solutions.
That's awesome, Noah. One thing, Crystal, I think we kind of touched on this a little bit, but speaking of that idea of like finding solutions, finding services that we need for folks, can you talk a little bit? You were kind of the inspiration for the aftercare program. Can you talk a little bit about how that came about?
Yeah. So when we were moving folks out of our co-lead shelter, and they were getting a ton of supports within our shelter. We were supporting with really intensive case management. And they were moving into housing, and just depending on the type of housing they went to, they were getting different levels of support. We were experiencing some folks come back to co-lead to ask for support. We were seeing folks just struggling with understanding certain components of their lease, that they needed to be at their housing for, a certain amount of time. Like if they were gone for a full 90 days, their unit could be considered abandoned and things like that. So we wanted to, we noticed that there was a need. And the idea was we didn't want to see people return back to the streets. People didn't want to return back to the streets, and really focusing in on the things that can impact somebody's housing being lost, such as their behavioral health, their maybe legal concerns or issues that lead them to, when they don't resolve it, could lead them to incarceration, which could impact their housing, or just something as simple as not understanding how to pay their rent. Sometimes the rent is needed to be paid online. Some folks didn't understand that, or how to just fill out a money order. So that's really what led to it. Just seeing the need from the participants we were serving, and then understanding that as a whole in the community that there could be other folks that are experiencing those same challenges.
Yeah, and I love this question, Kyler. It's talking a little bit about this idea of like PDA and DESC supporting or collaborating on the mayor's agenda to increase shelter capacity. How can it be made effective at ending homelessness how can it be effective at ending homelessness possible? And how could an advocate in this call support that? And I guess I'll throw that to Noah first, and then but I'll say this. I mean, PDA and DSC were supportive of. We went to council. We watched these 3 pieces of legislation get passed, and I know all of us were kind of at different ends talking about how to make sure that what was being passed and how it was being implemented is, again, this idea that Noah touched on, this like quality over making sure that it's very high quality, that we have the money we need to be able to provide the services and the resources that we need to our populations who we're serving. And I'll let Noah talk a little bit more about that if you're up for it, Noah.
Yeah, sure. Yeah, we're very supportive of the mayor's efforts. We clearly don't have enough of all the things people need, and shelter is one of them. And so we're supportive of bringing those online. And so we played a role in helping support legislation, and then help think through, to Ashley's point, like what does shelter design need to look like if we're going to support high needs folks, and that involves investment, and it involves commitments from providers, all that stuff. I think one thing that advocates on this call can help support it is on, if we want shelter to help end homelessness, we have to ensure that there is throughput. Shelter does not end homelessness. It provides a critical survival service. It can help people stabilize when it's designed right, but it doesn't end homelessness. And I don't think anyone in the administration or no one's advertising that it does. But what we have not done well as a community is ensure that shelter also aligns with what housing resource we have in our community, of which we don't have nearly enough, to be clear, and this group knows that. But what we do have is we have housing programs that are designed specifically in ways that I talked about earlier to meet the needs of some of the high needs folks that are hopefully going to end up in the shelter expansion work that is in the shelters that are being expanded through some of this work. And how do we assure we are being strategic about what resources we have and aligning them the best we can? Talking about that can sometimes feel a little wonky, but it is super critical. So the idea of throughput is absolutely something that we need to be asking for anybody in the housing sector, anybody interested in seeing homelessness resolved. It's not just bringing more shelter online, but how do we ensure people when they access shelter, we're creating as many pathways on the back end for people to leave shelter into a permanent destination out of homelessness.
Yeah. And I know that this is the important part that we talk about is that like the idea of having while we have this limited amount of housing resources that we have this shelter position, that the shelter is also a place of for our population at least, that we see them have more success when they go on to supportive housing. For some folks, when they have a little bit of a pause, they have a place to get a little bit of support, especially get some like of the legal entanglements quashed and taken care of, put them into that position and then move them on to housing. And I think that, one thing that we talk about is that sometimes being in shelter deprioritizes you for housing, and making sure that like that's a conversation that I think we all need to be having is like, how do we kind of make this a continuum? How do we move people along? Lindsay, do you have anything to add, or Crystal?
I mean, from my experience, I've seen, for example, we had a participant, Crystal touched on it a little bit earlier, that just, she had some behavioral, she had trauma, really, is what it was. And the wraparound care, the aftercare, supplied was a lot more. Let me say it this way. We had almost an exact similar situation at another building. This building, our team actually went in to kind of support the case management and the property management there. They weren't paying their rent. Like there's several things going on, and we had almost exactly the same mirrored situation. She had hoarding tendencies, and they had very toxic relationships at least at the buildings that I've worked out. They can have guests, but they are responsible for their guests. And so if we have a situation where they're violent, or the tenant is held responsible. And I don't like to use the word recycled, but she was evicted, right? She was evicted with $35,000 in debt, and then she also had an eviction on her record, which makes it increasingly hard for her to get housing again. And in the comparison, it's really just because she didn't have enough support, like not for lack of, because we didn't want to supply that, but just because, like Noah was saying, it's sparse. It's very sparse. And so my opinion, on this is that if we can stabilize them as much as possible in the shelter model before they go into supportive housing, if we can supply things like lease classes, how do you sign a lease? Here's an opportunity for them to ask questions. If we can provide work source options, at Gene Darcy, we had I2 strategies, and she would come in and help with their resumes and really make a plan with them, and get them stabilized. And with just bringing on as many resources as we possibly can, and building a safe community for them to grow and feel safe in, I think is vital at this time. Yeah, that's
Yeah.
what.
And I think
Yeah.
like this is like a really important point, I think, and this is something we talk about internally, is that there's no wrong way to get someone housed. There are like a bunch of different paths. And the most important thing is that to echo what Noah said, that we don't want them getting stuck in shelter. Shelter is not housing. And so it's been just I think like we all are, I think that for the survival, for the needs, for the fact that we don't have housing now, this is a model that we're using that has seen a lot of success, and then making sure that that warm handoff happens to get them into that supportive housing. And I know we're at time or pretty close here, so I just want to say that thank you so much to the Housing Development Consortium for putting on Affordable Housing Week. I've learned a lot. And Kyler, I don't know if you want to close us out or have it anything.
I should probably unmute. Yeah, well, thank you, everyone. Thanks so much to our panelists. I'll send out a post event email with some more links and contact info for our panelists for any attendees that want to connect later. I also think that there's like we can keep building on some of these ideas of like if we're going to have more shelter beds, we need to think about as a affordable housing consortium, like what does throughput look like, and how do we bridge connections between people that are being supported in shelter into really amazing housing placements. So thank you everyone for being part of the discussion. Hope to see many of you later today at Stoop Brewing. That starts at 4:30. Yeah, I think that's all for me. Thanks so much for being here, everyone.
Thank you.
Thank you.